working through this one here.
Okay, all right. Here we go. After initial stabilization, what is the most appropriate next step in management of this patient? 45-year-old man brought to the ED after a motor vehicle accident, has deep laceration on left thigh, has experienced difficulty breathing. Blood pressure is 90 over 60, pulse of 120, respirations are 28. O2 sat is 90% on room air. On physical exam, pale, cold extremities, cap refill, time is 4 seconds. There's no evidence of head trauma or chest injury. Laceration on thigh is actively bleeding. Okay, so we know that I was initially thinking with the low blood pressure and the high pulse, but then he has cold extremities. Let's see. Okay. Saline bolus. Is he bleeding? Yes. Actively bleeding, deep laceration, difficulty breathing. Patient stabilized. Okay. I don't think it's time for heparin. I don't think it's time for furosemide. My initial thoughts are like, okay, saline bolus just to get blood pressure back up and get him some fluids, or applying a tourniquet
Okay.
but I don't know if stabilization means, oh, like, does that mean the bleeding is stopped? That's what I'm like. If you're actively bleeding, I'm gonna try to stop the bleeding. So I'm like, maybe it's tourniquet to the injured leg first,
Okay.
bolus second. That's as I talk through it, maybe that makes more sense because why
Okay.
would you let this bleed out and then just give fluid and let him keep bleeding?
Sure.
Yeah, I think so. That's what I would do.
Yeah. So this one, yeah, definitely for sure, right? Pressure or tourniquet here, right? Stop the bleeding
Hmm.
first. Of course, right? I mean, that's why, your board exams are a little bit interesting because in real life, right? We're not thinking, this all happens at the same time. You know what I mean?
Right,
Stop
right.
the bleeding, give them a bolus, right? Get call for blood, right? Things like that, right?
Okay,
But that's not how the test is written, right? But yeah, you're exactly right, right? So patients bleeding out, right? You want to apply pressure in some sort of way. So a tourniquet's
okay,
good here, but you can actually put, physical pressure with a 4x4 or some gauze there, right? And then
okay,
obviously, right, you want to replace the blood. So initially, as you're waiting for, O negative blood, right? If you haven't typed and crossed the patient, then giving them boluses of normal saline, right, is going to be priority here too, right? But control the bleeding first, give them fluids, right, and then figure out, after that, after you've stabilized it, okay, do we need to go to the OR to ligate this vessel, right? But yeah, in the meantime, you did the right thing here. Stop the bleeding, give them
when
normal.
you're when you were reading this, I was thinking like which type of shock it would be. I'm like, okay, because I to me it feels like shock. It's like the blood pressure is low, pulse is
Yeah.
high, but then the extremities are cold. So I'm like, okay, hypovolemic
Yep.
versus like cardiac versus something else. That was in my thought process too. Is that still
Yep.
okay to
That's
do
good.
for this stuff? Okay.
Yeah. So low blood pressure, tachycardic, you got to be thinking some kind of shock, but they tell you that he's bleeding, so it has to be hypovolemic shock from hemorrhage.
Gotcha. Okay.
So got to be hypovolemic shock. Of course, if he has a history of MI and he has chest pain and he has all these symptoms and it's more cardiogenic shock. If he has an infection or a wound and he
Septic,
has,
right? Think
yep, high
septic
fevers and
or
low blood pressure.
anaphylactic.
Yep.
Okay.
So yeah, that's how you think of shock. But here for
Okay.
sure, trauma, for the most part, to be honest, trauma is mainly one of two things: neurogenic shock, right? If you have like a
Okay.
spinal cord damage or brain injury, that's going to be neurogenic. But if you have bleeding, that's going to be hypovolemic. So
Okay.